Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks, what is euthymia, euthymic depression, and euthymic bipolar disorder? Another question here would be, is euthymia the same thing as feeling normal? Now, many clinicians use the word euthymic to describe someone who has typical mood. Someone who is euthymic would be in a quiet state of satisfaction and have neutral or maybe slightly positive mood. The word euthymia has a Greek origin. It means well soul or well emotion. Now, it's not unusual to see in the assessment portion of a progress note, a clinician will put something like, client appears euthymic, oriented times 3. So this means the client is not depressed, not manic, not anxious, not angry. Essentially, their mood is what you might expect if you were interviewing some random person off the street. They are content, calm, and satisfied. Now, the oriented times 3 part is oriented to person, place, and time. So they know who they are, where they are, and what time it is. So this is where things get a little bit confusing. How can there be euthymic depression or euthymic bipolar disorder if euthymic mood is essentially normal mood? Mental health clinicians have pathologized many behaviors, right? We have diagnostic classifications that include symptoms of anger, like intermittent explosive disorder, substance use, like alcohol use disorder, criminal behavior, like antisocial personality disorder, extreme sadness, like depression, extreme happiness, like bipolar disorder, ritualistic behavior, like obsessive compulsive disorder, and excessive anxiety, like generalized anxiety disorder or avoidant personality disorder. We've also pathologized, in some sense, boundaries. Boundaries that are too distant would be something like schizoid personality disorder. Boundaries that are too enmeshed would be something like borderline or histrionic personality disorders. So just about every way a person can feel, think, or behave fits into some sort of mental disorder. And here with euthymia, we seem to be pathologizing the idea of just feeling normal. So now everybody seems to have a mental disorder. Well, I know it seems that way, but actually euthymia in depression and bipolar disorder is referring to the idea of feeling calm and content just in the context of major depressive disorder. I'll refer to this as MDD, and bipolar disorder I'll refer to as BD. The terms euthymic depression and euthymic bipolar disorder aren't actually diagnostic classifications. Rather, both of these terms refer to the same thing, an interepisodic phase of depression or bipolar disorder. Now, MDD contains periods of depression called major depressive episodes, or MDEs, and periods where an individual with the disorder does not meet the criteria for an MDE. Now, sometimes MDD is called unipolar depression. Now, bipolar disorder is a disorder that contains periods of depression, those major depressive episodes I talked about, periods of mania, manic episodes, and sometimes we see what's called a mixed episode, so an episode that contains both features of depression and mania. Now, these episodes in general are called major mood episodes. Sometimes they're called acute episodes. Now, technically, major depressive episodes are not required for a diagnosis of bipolar I disorder, so the disorder that has mania and depression. Usually people with bipolar I disorder do have both depression and mania. If somebody has periods of hypomania and episodes of depression, that would be bipolar II disorder. Now, when talking about these three disorders, it's important to remember that they cannot be comorbid. A person can only have one of these disorders diagnosed at any given time. Furthermore, the diagnostic procedure only goes one way. If someone with MDD has a hypomanic episode, then their diagnosis is changed to bipolar II disorder, even if they never have another hypomanic episode again. If somebody has a manic episode, their diagnosis is changed to bipolar I disorder, even if they never have another manic episode again. Now, of course, diagnostic errors can occur, which means someone's diagnosis might change from bipolar disorder to MDD because they never had bipolar disorder in the first place. So MDD and both of these types of bipolar disorder are cyclic. If someone has one of these disorders, they cycle in and out of these major mood episodes. Again, with bipolar disorder, there's times when they feel depressed, times when they feel manic, and times when they feel both ways, again called mixed episodes. And there's also times where they don't feel any of these ways. This is called euthymia. These disorders are also chronic mental disorders. So when people have one of these disorders, they usually have it for their entire life. A complete remission that is sustained indefinitely is not really common, but both disorders can be effectively treated in many cases, but the disorder is still there. So the symptoms can be treated, but the disorder remains. Now just looking at bipolar disorder for a moment. BD affects everybody a little differently, of course, but in general, if somebody has BD, about half of the time they're experiencing an episode, again, depressive, manic, or mixed, and about half of the time they're feeling euthymic. Now some people believe that during this euthymic phase, where there is symptomatic remission, the person with BD feels normal and is functioning normally. If you're not depressed and you're not manic, you must be feeling okay and functioning at a normal level. Interestingly, however, what we see in the research literature is that functional impairment is still present during these periods of euthymia for about 40 to 60% of individuals with bipolar 1 or bipolar 2 disorders. Namely, there are emotional processing deficits, especially at the higher social cognitive range, and this causes psychosocial impairment. These difficulties are tied to the idea of theory of mind, sometimes called mentalization. This is the cognitive ability to attribute mental states, such as beliefs, desires, and intents, to oneself or others. So essentially the ability to figure out what people are thinking and understand what you are thinking. When mentalizing ability is limited, social functioning becomes limited as well. In addition to this limitation with theory of mind, we also see difficulty sustaining attention, as well as working memory and verbal and visual memory deficits. Not surprisingly, when we're talking about MDD, some of the same functioning deficits have been observed, but we really need more research on this specific topic. Here we know a little bit more about bipolar disorder as opposed to MDD. So when we use the term euthymic MDD or euthymic bipolar disorder, are we using the word euthymic incorrectly? Well, really this can be answered both no and yes. Technically no, because the individual would still meet the criteria to be considered euthymic, no mood symptoms, they're tranquil, content. Somebody can have limited mentalizing ability and still have a calm and stable mood. But in another sense, yes, because when people think of euthymia, they think everything's fine. And for many people with these disorders, they are still suffering even between major mood episodes. I think the important takeaway from the concept of euthymic depression and euthymic bipolar disorder is the period of time between acute episodes still presents functioning challenges for people with these disorders. So is it okay to use the word euthymic outside the context of major mood disorders? I think so. I think it's a concise way to document feelings, like in a progress note, for example. Another possible usage for euthymic could be in daily conversation. When people ask you how you're doing, a lot of people say, I'm fine, I'm doing well, I'm okay. Not a lot of variety there. People kind of tune it out. It's considered perfunctory. You kind of have to say those things. Now we could consider something like Data from Star Trek, right, the character played by Brent Spiner. When someone would ask him how he was, he would say, I'm functioning within established parameters, one of my favorite lines of his. But that may be a little too formal. I would say let's add something like, I'm euthymic. The term efficiently transmits information about how you're feeling. Now I know whenever I talk about topics like euthymia and major mood disorders, there will be a variety of opinions. Please put any opinions and thoughts in the comment section. They always generate really interesting dialogue. As always, I hope you found this description of euthymia to be interesting. Thanks for watching.